Hello, my dear students. Welcome to Chips and Game for R.A.T.S. The chart that I have chosen for the day is peptic ulcer and gastric cancer. Both of these are independent essay questions on their own. And in today's class, we shall be dealing with a normal picture of the stomach, the peptic ulcer, the gastric carcinoma, early gastric cancer, and some line diagrams as well. Also, I shall be highlighting the importance of today's discussion, which is covered in nearly 20 pictures confined to a single chart. We shall go to them one by one. First, I shall be starting with the normal anatomy and histology of the stomach. Just a rough idea. So there is a lesser curvature, there is a cardia of the stomach, there is a greater curvature, and the pyloric antrum. And these are what is called as the rugal folds. I find that there is a fold of the mucosa, which is exactly what I am seeing. And these depressions are called the crypts over here. This is a mucosa. Then there is a muscularis mucosa, submucosa, the muscularis layer, and the serous. Now, I shall be dealing with the peptic ulcer. The gross picture of the peptic ulcer. The peptic ulcer by itself is a well punched out lesion. It hardly measures about 2 centimeters, and the floor is supposed to be clear because of constant acid digestion. This picture highlights one important feature. I find that all the rugal folds are being drawn towards this ulcer. That is because it is a long-standing lesion. There is fibrosis, there is contraction, and hence this stellate appearance. Lower down is another picture of a peptic ulcer. Again, a very well punched out lesion, as though you have put a punching machine into the gastric wall. And there is a clear flow. The rugal folds again are drawn towards this. This is the gross appearance of the peptic ulcer. What is the microscopic picture? In the microscopy, I find that this is the normal mucosa, and this is an area of ulcer. So I find that the area of ulcer is shallow to not very deep. This is called the floor of the ulcer, and what it rests on is the base of the ulcer. What are the zones of the ulcer as such? So in your books, it will be given as there will be a zone of necrosis, a zone of inflammatory infiltrate and granulation tissue, then a zone of cicatrization or scarring. This is what we are seeing. A normal mucosa, necrosis, inflammatory infiltrate, granulation tissue, and cicatrization or scarring, which is very well explained by this diagram. I am able to see the normal mucosa, an area of ulcer in which nothing is seen. This is a zone of necrotic debris, below which there is an inflammatory infiltrate, and there is a granulation tissue. Granulation tissue means what? There is a proliferation of the capillaries, the fibroblasts, along with the inflammatory cells. It breaches the muscular layer, it is going deeper down, and this exactly is the base of the ulcer, which we cannot see, but generally it is felt. But in a case of gastric ulcer, we will not be able to feel also unless it is resected. This diagram you people can draw for your answers. Again, a diagrammatic picture of the same. This is an endoscopic picture showing a well punched out ulcer. There is a well circumscribed ulcer, hardly about 2 centimeters or less in diameter. The floor is supposed to be clear. And this is the diagram of the ulcer. Generally, the peptic ulcer, it has got a slightly sloping edge. This is the edge of the ulcer. And what we see from the surface, this rim is called the margin of the ulcer. This is the edge of the ulcers. They are in the form of a slope. And beneath that, there can be proliferating blood vessels. So there is a blood vessel over here. And this is one of the common reasons for an erosion and a hemorrhage in a case of peptic ulcer. Now, whenever we talk about peptic ulcer, one thing worries the surgeon as well as the pathologist. What is the difference between a benign and a malignant ulcer? So the benign ulcer, it is small, it is punched out less than 2 centimeters. Whereas the malignant ulcer is large, it can be irregular, 4 centimeters or even more in diameter. The floor is covered with necrotic debris and the edges are everted over here. Here it is flushed with the surface, whereas here it is everted. Sometimes the ulcer can be irregular in outline. So these will be the differences between the benign and the malignant ulcer and a line diagram which you people shall and will draw. Then what about gastric carcinoma? So this is the gross appearance of a gastric cancer thanks to LME, a beautiful picture, a large crateriform ulcer. I find that the floor is covered with necrotic debris. You can appreciate the blackish discoloration over here. And these are the margins. Sometimes the edges somewhere within, it can be undermined, and it sometimes be there can be a heaping up of the margins also at the edges. This is one form of gastric carcinoma. There is another form in which I will not be able to see the ulcer at all, but then the entire wall is thickened. Compare it with this, it is usually thin, it will collapse. Whereas in this case, it is thick, measuring about, say, 1.5 or even 2 centimeters in thickness. And it is uniformly thickened, resembling a leather bottle, or it is called a Lionitis plastica, a leather bottle stomach. And even here, I am not able to see any ulceration. That is because the entire wall is infiltrated by the tumor cells. These are all tumor cells which are round. The nucleus is pushed to the periphery because of the occupation of the cytoplasm by the gastric mucin. These are called mucin secreting adenocarcinoma or signet ring cells. Signet ring cell means it is the ring of a king. So this is a signet ring. Those days, the king will be able to make the markings by means of the emblem over here. So this is a signet ring, and the cells have got exactly the same appearance. So this is the symbol, and this is the nucleus pushed to the periphery. The entire one is a signet ring. And this can be the counterpart of a carcinomatous, an ulcerative lesion. So here I am finding large irregular glands. Look at the glands. This can be okay, fairly normal, but even this is not. But look at this one. It is large, irregular, and it is lined by multiple layers of cells. The cells will be appearing dark because of the hyperchromatic nuclei. There is a stratification, and the tumor cells will be infiltrating the muscular ring. This is a muscular zone in which I am able to see the tumor cells. So it is an adenocarcinoma. I call it adenocarcinoma because I can make out the glandular outline. Carcinoma because it is infiltrating the muscular region. So I hope you people are able to appreciate the difference between a peptic ulcer. Look at the peptic ulcer over here and a gastric carcinoma. That too, you can have an ulcerative lesion or it can be a Lionitis plastica. These are the differences. And you will also be asked the differences between a benign and a malignant ulcer, which you people will have to mention. Not the least, you find that you should know the zones of a peptic ulcer. In today's class, we have covered the normal stomach, the diagram or the scheme of the peptic ulcer, the differences between the benign and the malignant ulcers, the gross and the microscopic features of the peptic ulcer and the gastric carcinoma. This can be asked as an essay or a short note. Comparison is very well asked and appreciated. MCQ, any number can be asked. 5 hours, definitely a specimen will be kept. Gross, microscopy, chart. And these can be my sources of references. This here is an early gastric cancer, which can be in the form of, say, a evolving lesion, or it can be an excavating lesion, or it can be an ulcerative lesion, or it can be flat. So these are the various forms, but in all you find there is no invasion of the muscular layer. This is called early gastric cancer, which you people can mention in your answers. These are my sources of references. I would like you people to kindly go back to them and read, because it can be asked as an essay question with a clinical picture as well as a problem-based question. Thank you.